Hello everyone, my name is Sultan Al-Qahtani. Today we'll talk about our research topic with my colleagues Ghada Al-Shehri, Iman Al-Khdairi, Mudit Ghaim and Wajdan Al-Shamrani about assess the knowledge of composite shade selection and color matching among dental students in Riyadh, Saudi Arabia, a survey supervised by Dr. Sara Shamri, and this is the application number. Dental color matching is an important topic and involves elements of both science and art. Dentistry has changed through the year. Earlier, the dentist was avoided until extracting the tooth was the only choice. A few years later, the success of restoration mainly depends on restoring the function. Furthermore, operative dentistry has advanced over a period of time, and nowadays, aesthetic, especially color matching of the restoration as well as the translucency and opacity have become essential concern to the patient as well as to the operator. Additionally, restoration are accepted to mimic the shade of the natural dentition.
Hello everyone, my name is Ghada and I'll continue talking about proper shade selection. So, the aesthetic of the restoration mostly depends on proper shade selection and color matching, which is a multifactorial and complex process since it depends on more than one factor. For instance, the source of the light, patient position, surrounding tissue, time of selecting the shade, and the status of the tooth can change the perceived color. In addition, there are two main methods for shade matching. The first one is the visual method, which is the most common one since it's simpler and cost-effective. Visual shade guide like Vita Classic, Vita 3D Master are examples of this method. The second one is instrumental method, which is more accurate. Instruments such as spectrophotometers and color meters are used. To sum up, the scientific principles of color and shade matching are required knowledge a dentist must have.
Hello everyone, I am Iman and I will talk about the aim of this article and its methodology. So the purpose of this article is to determine the knowledge of dental students, to improve the quality of dental schools, and to ensure to have qualified future dentists. The materials and method. 300 questionnaire survey in English consists of 20 questions about demographic information to assess the knowledge among dental students in Riyadh city regarding scientific principles and artistic qualities in shade selection procedures. Some of these questions were adapted from previous articles. You can see the reference of these articles below. The data will be collected using Google Form and the analyzing by SPSS system.
Hello everyone, I am Modi and I will talk about the references and I will read some of the questions. Here is the references, here is the time follow chart, and here is the appendix. Gender, female or male, which university are you enrolled in? Riyadh Ilm University, King Saud University, King Saud bin Abdulaziz University for Health Science, Prince Noura bint Abdurrahman University, Al Farabi College, or others. Currently in which academic year you are? 4th, 5th, or 6th, or internship. Do you consider that you have enough knowledge about composite shade selection procedure? I have enough knowledge. I need to learn more about it. I have no knowledge. Which method do you prefer to use during shade selection? Visual, only from the eye vision, vital shade guide, instrumental, or more than one technique. Best time of shade selection, before the preparation or after the preparation. What is the best condition to choose the tooth shade? When the tooth is wet, when the tooth is dry. Do you remove the stains and debris before the shade selection? Always, sometimes, never. Do you ask the female patient to remove any part, cosmetic or lipstick? Always, sometimes, never. Do you consider the patient's clothing during shade selection? Always, sometimes, never.
Hi, I'm Wajdan. I'm gonna continue the survey question. In the which level your patient should be during the shade selection? Upright position, supine position, reclined 45 position. According to the dentist, in the which position your patient should be during the shade selection? Eye level directly above the eye level, below the eye level. Which type of the light do you use for shade selection? Natural daylight, dental light, fluorescent light, doesn't matter. How long do you take for shade selection? 5 seconds, 10 seconds or more? Which type of background color you use to rest your eyes at? Gray background, blue background? I don't use any background. Do you usually take another dentist's opinion during the shade selection? Always, sometimes never. Do you take the patient opinion during the shade selection? Always, sometimes never. The most common shade you use in your practice: A1, A2, B1, B2, or combination of the color layer by layer. Do you face any difficulties during the shade matching? Always, sometimes never. Do you think you need more education and practice about the shade selection and the color matching? Yes or no? Thank you.